Hello, my name is Shika. I'm going to be your nurse today. What brings you in?
I've hurt my ankle.
Oh, okay, so what happened?
2 days ago, I was playing soccer
Oh,
and I hurt it.
oh, okay. Have you tried anything for it?
No, not yet.
Not anything?
I've taken some ibuprofen, but that's it.
Oh, okay. Gotcha. Do you have any family history or anything that
Nope.
goes on with the family? No? Um, where are you working at?
I'm working at Jiffy Lube.
Okay, are you going to school?
Yes,
Okay, good. How often do you play soccer?
about twice a week.
Twice a week. Okay. Um, do you, let's see. Have you taken any other medications besides ibuprofen?
Nope.
No. Um, are you allergic to anything?
No medications.
No. Okay, no allergy to medications. Okay. So I'm gonna go ahead and do an assessment on you. Can you tell me your name?
Brighton.
Yeah. Can you tell me what time it is?
It is 8:30.
Okay. And can you tell me where you are right now?
I'm in the hospital
Okay. And can you tell me why you're here?
because I hurt my ankle.
Okay. Um, okay. Sounds good. I'm gonna go ahead and check um, your skin first. Checking for cyanosis. I'm checking for pallor skin. I'm checking the fingers for any clubbing. On infants, it's important to check for mottling because it can mean it can happen when there's extreme changes in ambient temperature, whether it being really cool or really hot. Um, but it's also common in preemie babies and also common in children with Down syndrome or hypothyroidism. Um, and then now I'm going to go ahead and check the um, head. I'm going to check the frontal sinuses up here. And then I'm also going to check the maxillary sinuses over here. Um, and then I'm going to go ahead and check the neck. I'm going to check for jugular JVD, jugular venous distension. I would start as the patient being supine um, when they are laying in the bed, and then raise the head of the bed while they're looking away, and then see where stop at where the jugular vein, I can see it, and to distinguishing the jugular vein and the carotid vein. You can't feel the jugular vein, but you can see it, so that's how I know it's the jugular vein. Um, and a way to check for the JVD is to keep the patient at the angle where you can see them, see the jugular vein. I take two rulers and then keep one at the jugular vein and the other one at the level of their heart, and see where it meets. If it's less than 9 centimeters, then that's normal. If it's anything more, then that's abnormal, and it could mean that they can have some attention pneumothorax or some heart problems. Um, so next, I'm going to go ahead and check the neck. Oh, also with the head, I forgot to check for head lice. I would um, clean the hair first and then section it off to different sections so we can go ahead and see the scalp. And we can use comb to comb the scalp as well as the hair so we can see if there's any active lice. And that's how you check for head lice. So back to the neck, we'll go ahead and listen to the carotid bruit. I would get the stethoscope, and then they listen right here for the carotid bruit. If you hear a carotid bruit, then it can mean that they have some mild occlusion, or it can mean they have some stenosis or narrowing of the arteries in their neck. Um, Next, we're gonna go ahead and feel the lymph nodes. I would check for the preocular lymph nodes, post-ocular, um, occipital, parotid, and then there's the submandibular, the submental, the posterior cervical, and then the anterior cervical, and then the supraclavicular lymph node, um, just to check to see if there's any swelling or if there's any tumors or anything. You would go ahead and feel that. Next, we're gonna go ahead and check the eyes with the ophthalmoscope to make sure the eyes are perla. That stands for the pupils are equal with each other, and they're also reactive to light. So I would just take my pen light and just tell them to look straight forward, and then you would just check their eyes. That's reactive, and that's reactive. So in infants, it's important to check for red flecks. What the ophthalmologist comes and does the checks, they dilate the eyes a couple hours before, and then when they look from their ophthalmoscope, they want to look for the red flecks in both of their eyes. If it's uneven, or if there's some discoloration, if there's dark spots in their eyes, if one is brighter than the other, or if um, you don't even have a red flex, then that can indicate some serious ocular disease and tumors. So that's why it's important to check for that. Next, we're gonna go ahead and check the ears with the otoscope. We just look in the ear. You just hold it kind of touched with one hand, and then you look in their ear. You want to check the ear canal and make sure there's nothing blocking it, like serum, like wax that can build up. You also want to check their tympanic membrane, which is translucent and kind of pearly grayish in color normally, and it has a good base. If it's red or if it has any discharge, if it doesn't have a good base, if it looks like it's ruptured or perforated, then that's not normal. They'll have to go see your doctor for that. Next, we're gonna go ahead and let's see, what do we check next? We're gonna go ahead and check the mouth and the throat. So for the mouth, we just want to check for the pillars, and then we want to check for the buccal mucosa, the tonsils, in the back of the throat. We're going to check the uvula that's hanging in the back of their throat. We also want to check for the hard and the soft palate, which with infants, when they're just born, you can check if they have a cleft palate or a cleft lip, and things like that. And then next, we're going to go ahead and check the chest wall. I would first listen to them with the stethoscope. So first I'm going to listen to the back, and then work my way in the front. So you want to go ahead and start at the top, and then you listen to this part. You tell them to take a deep breath slowly, and then exhale. So listen to one part, and then you go right across. Listen, and then you go down, and then you go across, then you go down, then across, then down, and then across, do the same thing in the front. I'm going to start at the top and then go across and then down and then across, down and then across, and then down and then across. And you also want to make sure you listen to them on the side as well. Just to be able to hear all of the lobes of the lungs, the top lobes and also the 3 lobes on one side. So you just want to make sure you check all that. In respiratory distress in infants, you can see grunting, you can see nasal flaring, you can see increase in heart rate and increase in respiration rate. You can see a lot of retraction, whether it be intercostal or subcostal, um, or even a supraclavicular retraction. You can see an immediate color change. You can see accessory muscle use and things like that. It's kind of the same thing with adults. You can monitor altered mental status more. Even in children, older children, you can see altered mental status. In adults, you can see increased respiration rate. You can see a decrease in their blood pressure as well, an increase in heart rate, having dyspnea on exertion if they're in respiratory distress. And you can also have um, difficulty breathing. And yeah. So going back to the SOAP assessment, um, I would take the vitals, make sure to get the weight because that's the 5th vital sign, and then I would we would go ahead and get a foot X-ray um, to make sure there's no fractures. And it turns out it's just a sprain. So yeah, I would recommend doing RICE or rest, ice, elevation, and compression. Um, I would make sure to get the ibuprofen around the clock, um, and then just do some warm-ups before activities, and then start off with gentle practices before you do any extreme exercises. My medical diagnosis would be a sprained ankle, and then nursing diagnosis would be risk for trauma or impaired mobility related to trauma with an activity, as evidenced by the redness or the swelling of the ankle, loss of mobility, loss of range of motion, and yeah, and I'll just do a lot of